This is one of 5 lifelike mannequins that we practice on, ranging from a newborn infant to adult male and female simulators. Extremely lifelike, they're designed to simulate real patient conditions and responses to treatment. Their eyes blink and their pupils contract. They breathe and have a heartbeat. They can have seizures, bleeding, and pain, and can talk to describe the symptoms they are experiencing. They can have IV lines started, chest tubes inserted, and can recognize drugs and dosages given to them and respond. And the female simulator can even give birth to an infant simulator.
This is Noelle, and she can do a lot of the things the other mannequins can. She has her pupils react. She can have different breath sounds, heart sounds. You can simulate anything with her that you would a regular woman. But the main thing about her that's so neat is she can actually birth a baby. Here she also has this fetus here. And what's great is you can simulate not only a normal delivery, but things that you would worry about, I know as a nurse, that might happen that you were not prepared for, like the nuchal cord, placenta previa, even fragmented placental parts. These come apart, and this could be inside her where you would have to actually go in and retrieve those parts. Mom can be preeclamptic, meaning she can go into seizure activity. We can adjust her blood pressure. She can even code for us. So we can play out a normal delivery or the most dramatic delivery, meaning mama may not even survive. So once Noelle delivers a baby, we can turn to this high-fidelity newborn Hal. He can do lots of different things as far as what an actual newborn would do. He has pulses. He has a fontanelle pulse, a brachial pulse, and pulse in the umbilicus. You can have chest rise and fall, and you can either simulate both lungs, just the right or just the left if you're trying to play out different scenarios. You can take an actual blood pressure in the baby's arm that'll give you an actual reading. You can intubate the baby. Baby Hal can be a boy baby or female genitalia to practice catheterization with a very small catheter. He also has injection sites on the hip here. There's also actually a tibia bone that can be replaced, and it comes with quite a few of these with the baby, where you can practice your intraosseous injections. He can become hypoxic, where you would need to apply oxygen and it actually turns blue. His face turns blue. Also, baby Hal can have seizures, seizure activity. He can represent shoulder dystocia, where one limb is moving freely and the other one's not. So you would have to notice that as the nurse or clinician taking care of the baby.
This mannequin that we have right here is a Laerdal 3G mannequin. He's a high-fidelity simulator that allows us to do complex scenarios with any individuals that might need any training and deterioration or anything to help them get experience with what situations they might see with patients. His capabilities are pretty vast for what's on the market. He can have pupillary reaction. He can also have heart sounds, bowel sounds, lung sounds. We can make his chest rise. We also can feel pulses on this mannequin. And in saying that, we can do it in multiple areas. We can do it pedal, popliteal, femoral, radial, as well as carotid. We also can intubate this patient and hook him up to a ventilator. He also breathes CO2, and he does have fluid-making capabilities. He can sweat, he can froth, he can also produce urine, and also bleed. So this mannequin has a lot of the capabilities that you would want to practice with your associates here at CHRISTUS St.Michael.
If you're coming fresh out of nursing school and you haven't really had the opportunity to work with patients as much as you'd like, use a mannequin, either a high fidelity or this type of mannequin where you can get the general knowledge that you need to start an IV, to draw blood, to put in an NG tube, to put in a Foley that you haven't actually done on a person, but you'll feel more competent and capable when you put one or start an IV in a patient.
The center has 4 patient rooms, configured exactly like any found in our hospitals. A medical and surgical patient room, an ICU patient room, an emergency department room, and a labor and delivery room. Each room is configured to duplicate a real hospital room, allowing staff hands-on practice with the same equipment and supplies found throughout our system. The Skills Lab offers students the opportunity to practice clinical skills, from IV insertions to CPR, and have their competency assessed by the faculty. And the center is open to other local healthcare educational institutions, so their students can experience this exciting and interactive learning experience. This is the nerve center of the facility, the control room, where associates create, manage, and observe the situations in each of the 4 patient rooms. The associates can recreate clinical events and potential patient complications. All of the simulations are captured on video and may be viewed at the completion of the exercise. Debriefing allows participants to recognize errors made during the scenario and make corrections. This builds confidence and skills for all of our caregivers and provides a safer healthcare experience for all we serve.
As we get a network of these throughout the CHRISTUS system, we want to share best practices. We want to share those very rare occasions that happen that we found out or someone found out. We set up a scenario over it and now it's not rare. I did it 10 times in the simulator lab, and I can do it on the floor or in the ER, OR, wherever. You know, things like when you're delivering a baby, you don't expect the mother to have a heart attack. We can do that here. We can do that over and over. It will definitely differentiate CHRISTUS as a healthcare system that understands the highest quality comes from our associates taking care of our patients at the bedside, with our doctors and with our staff, our nurses. We will create an environment of learning, we will accelerate it, and we will achieve that.
I think it was just amazing. Speaking from a nursing standpoint, you can play out so many different scenarios with her or with the baby that as a nurse you always wonder about those what if scenarios. What if you had a patient that was going into labor and then she had postpartum hemorrhage? What would you do in that situation? Or the baby had shoulder dystocia, which could be quite common. I think when you see those types of things played out through simulation, you'll be so much better prepared for it when it happens in real life.
Developing the ability to think in a crisis and be confident, not that you can save someone, but that you know what to do in those first minute or two to rescue them until help arrives, is the difference a lot of times between a good outcome and one that's not so good.
This incredible 5,200-foot facility can even be converted rapidly into a disaster response center. By removing the partitions between the rooms, it allows staff to practice a number of simulated emergencies that would put any hospital's preparedness to the test.
I am very proud to be a member of this facility. It's an amazing opportunity for us to have in healthcare. There's not a lot of hospitals that have this capability for their staff, and that's what makes us a step above.
The students love the simulation, and I will say now with new generations of people coming up through nursing school, technology is the way to go. They love the hands-on. They don't like to sit and read it in a book. They like to see it played out, put their hands on the patient, really get in there with the newest technology out there.
Yeah, I get, my kids call them chili bumps. I get chili bumps when I walk in because it is so stimulating to see what we can do. And when you come in and someone's delivering Noelle's baby over there and then having to take care of the baby and her, or when the 3G simulator's over there and he's having low blood pressure and he's clammy and sweaty, or this fella here that's got one leg cut off and we've got to control the bleeding. This is the most exciting thing I've done in 12 years with CHRISTUS Health.